Well, as I explained last time, having high blood pressure is like having a lot of water running through the pipes of your house. Sooner or later, bad things are gonna happen. But there are two things that might happen: either something acute, like an emergency right now, or some damage that is gonna be done throughout time. So let's talk about that first, like chronic damage. Um, Arteries are elastic. They are very good at receiving lots of blood, and they simply stretch to receive that amount of blood, and they just go back to their normal size. But if they are under a lot of pressure for a long time, they, like any other muscle, they will start growing and reacting to that high blood pressure. So they become more muscular and they start narrowing. So the number one consequence of high blood pressure is the narrowing of the arteries. So as you can see there a healthy artery versus one that's narrowed and one that's severely narrowed. And you can imagine what can happen. But if you want certain examples and a further explanation, I'm gonna give it to you right away. Uh, One of the things that happens when your artery is narrow is that blood stops getting to the right places. So you can develop something that is called peripheral arterial disease. And you can see there the picture. There's this man who has pain on his left calf, sorry. So that's the symptoms you should be looking for to see if you're developing peripheral artery disease. What's the best example? Somebody that's walking and a certain distance, for everyone is different, maybe 100 yards, 200 yards, maybe more, they start feeling certain pain on their legs. And they have, it gets worse until they have to stop. And when they stop, the pain actually gets better and they're able to walk again. So if they wait for a long time, they will feel like nothing happened. They will start walking again, and again, the same 200, 300 yards, the pain is gonna come back. So that's a sign that your arteries in your legs are narrowing. And this process can even be worsened by fat in your arteries, cholesterol. So getting those two things together, high cholesterol and high blood pressure, might actually increase your risk. So that's one of the things that could happen and happen to the people with high blood pressure. The second one is that if this happens in your legs, it's going to happen somewhere else. The kidney is also very common. It's a very, what we call a target organ for the high blood pressure. So when the arteries in the kidney narrow, the blood flow decreases and urine is produced by filtering blood. Basically, blood flows through the kidney filters it, takes out the water, salt, and some things, and you urinate that excess of water. But if there's no enough blood flow, then that water, that excess fluid, is gonna accumulate in your body, and that's what we call retaining fluids. And you're gonna start having edema, swollen legs at first. So you should maybe take a look at yourself, and maybe you see that your ankles are a little bit more swollen than normal. Maybe it's because you have high blood pressure and it's not controlled. There are some other causes for that, but this is one that you should definitely take a look. And it's very, very common. I'm pretty sure probably one or more of the people that's listening might have noticed this. Well, the heart is the center of the circulatory system. It's a pump, it's a muscle, it's the biggest and hardest, strongest muscle in the body. But of course, like everyone, it gets tired and it has changes with high blood pressure. If they have, when the arteries narrow Just imagine that you have the garden hose of your house and you narrow the hose. Water would flow very, very, very fast, and it will try to uh, like take water back or reverse the flow of water. So this heart, the pump, has to make more effort to make the blood flow through a tube that is now narrower. So of course the reaction of every muscle when they have to do more effort, they grow. So the heart starts growing. But you know, the heart is not perfect. So eventually it will grow that much that it simply will be too big to carry its own weight. And not only that, the walls eventually, after growing, at first it grows strong like every muscle, but then it will simply uh, become weaker and weaker until you get something that is called heart failure. And you maybe have heard about that term, like, oh, he has congestive heart failure. Well, that's it, congestive. It has so much blood that that he cannot pump out, that he gets congested, choked on his own blood. That's what happens, and it starts reversing the flow, so it goes back to your lungs and you start having breathing issues. That is something you should also look for. If you're starting to have shortness of breath, maybe this is the cause of that. Another thing that happens, as I'm telling you, the blood doesn't flow as easy as it used to. So the main vessels, the main arteries in the body, have to sustain a lot of pressure. The main artery in the body is the aorta, which you see there in the image, and it starts growing and growing into what we call a aneurysm. And eventually, aneurysms are like a time bomb. I mean, arteries keep growing and growing and enlarging that aneurysm until it finally breaks. And the aorta carries 5 to 6 liters of blood every minute. So that's the entire quantity, or the entire amount of blood you have in your body. It passes through that artery each minute. So if it breaks, you have 30 seconds. So that's something we should take a look. That's why it is part of your screening things, like we have to do colon screening, you know, prostate, cervical cancer, breast cancer, and also we have to check for abdominal aneurysms, for the abdominal aorta. That's through an ultrasound. They just put it on your abdomen and they see the size of the aorta. Doesn't have any much symptoms, but usually it's not really painful, but it manifests with a pulsating mass in your abdomen. So that can happen. Maybe if you're there and you see that your abdomen, it's beating like a heart, that's what happens. Of course, with thin people, if you're thin, you'll be able to feel your aorta, like the blood flowing through it, so that's normal. But especially if you're older than 60 and you have like a big mass in your abdomen that's pulsating, you should get it checked. Dementia, that's another consequence of high blood pressure, and I don't see a lot of people talking about it. We do talk about dementias and Alzheimer's, which is one type of the dementia, but no one usually talks about vascular dementia, which is very similar to Alzheimer's or can be mixed up with Alzheimer's. But that's a good consequence. People think, well, maybe I didn't have a heart attack or a stroke, or my kidneys are well, so blood pressure is not doing anything to me. Well, wait, because maybe when you're 60, 65 or older, you will start developing signs of dementia, which can be disorientation in time. You don't know what time is it, what day is it. You stop recognizing people. Well, things like that. Actually, I'm going to be talking about certain dementias in my next webinar, but that's for another day. And also the losing of certain of your vision, blindness. High blood pressure doesn't doesn't leave you blind from one day to the other, not normally. It's something that's chronic. It takes time because basically you start having little hemorrhages in your retina, the back part of your eye, and you start losing certain fields of your vision. Like in this picture, you see that certain parts of the picture you can actually see pretty well, and in the center it's kind of blurry. That doesn't necessarily happen in the center all the time, but you start losing certain fields of vision, we call it.